Welcome to my presentation. Thank you for your introduction. So you know the title of my presentation. As said, I will keep it short. But yeah. So first of all, imagine you're a nursing student. You're a nursing student and you're in the third semester. You have a lecture on palliative care. And maybe you get to know the concepts spirituality and spiritual care. And yeah, that's it. There is no lecturer or a special lecture on spiritual care, but you're interested in the field of spiritual care, and now you'd like to know where to learn more and deepen your knowledge on this topic. Maybe this is starting point or one starting point of this research project. So all of us, I think, at least now, all of us knew that spiritual care is essential for holistic healthcare, and patients often experience existential and spiritual distress or concerns during illness. Health professionals are expected to recognize them, but yes, there's a lack of time, there's a lack of resources, there's a lack of room. And yeah, and with COVID-19, there was even maybe a lack of optimal education. But we've seen that since then, COVID-19, the digital education gained in importance. The WHO also outlined this in some reports. And now this is the background to my research questions. And here we see we have formulated 3 research questions. The first is about the availability. So the question was, what programs are there available to educate people in spiritual care, including mobile learning programs and which are digital education programs. The second one was the question about usability. So how do the online learning programs identified differ in usability? What are the formats, features, and how long does it take to complete these education programs? And the third one was the commercialization. So how much does it cost to do these programs? How are they commercially distributed? Who are the providers of the programs? Are those universities? Are those private persons? And what are the cultural and religious backgrounds? So many questions and much data. Let's have a look on methods first. We choose the scoping review design to map all of these existing programs. So it was a very broad design. We followed the Joanna Briggs Institute methodology and for reporting the PRISMA for scoping reviews guideline. And we've registered it, of course, in the beginning. And then we've started to search for databases, the traditional ones, PubMed, CINAHL, Web of Science, PsycInfo, with a last search on the 7th of October 2024. And then we've done an additional search. In the article, we say Grey literature search, with a last search on the 2nd of March 2025, where we've included as searching platforms Google Search, edX, Coursera. So these are platforms for massive open online courses. And then we've also searched the app stores, the known ones, App Store, iOS, and Google Play from Android. And then we've used the language competencies of our research, international research team, and then we've said to ourselves, we do the Google search in different languages. We've supposed that the scientific publications, there's at least the abstracts are English, so we will find them. But the Google search was conducted in the end in 8 languages. So it was Danish, English, German, Brazilian Portuguese, European Portuguese, Norwegian, Swedish, and Spanish. We've simplified the search strings from the databases in a much shorter version. So as we know, as everybody of us will use in Google search, and we've searched for the web pages. Of course, we've also formulated eligibility criteria. We've used the mnemonic PCC for scoping reviews. So it's population, concept, and context. For the population, we've included all undergraduate and postgraduate healthcare professionals. And healthcare workers were defined, as we've also heard in the last days, as in the generalist specialist, a model of spiritual care, which includes healthcare chaplains as healthcare workers. We've excluded informal caregivers, such as laypersons, family members, friends, and neighbors. So all programs which aim at this, which aim at these persons were excluded, and we've excluded priors to other religious leaders or members of religious communities, who are not working in the healthcare sector. As a concept, we've included all digital educational resources developed to educate healthcare professionals in generalist or specialist spiritual care competencies, where we've defined spirituality according to the EAPC definition and spiritual care according to the EPIC network. And concerning the programs, the eligibility criteria was that they have to be a component which is self-paced. They have to be asynchronous learning. They have to be asynchronous. So it's not only a Teams meeting, which is synchronous learning. And so they have to be in parts asynchronous, so that self-paced learning would be possible. And we stayed open. They could be delivered online or blended in hybrid formats. Excluded, as I've already said, were all those programs which are solely synchronous. So lectures given via Zoom or Teams. Then we've excluded mere spiritual care videos, learning videos, or video sharing platforms, or serious games on this topic. And of course, the traditional education formats like books and so on. And the second one was we've excluded all those programs focusing on mindfulness, on resilience. So we know that those components are important for spiritual care and spiritual care provision, but we've excluded them to focus more on this component of spiritual care education. And the context was very open. So there was no specific context with no time limit of study publication, and the context was in any healthcare professional context, independent of the geographic location or cultural religious background. So last slide on the methods. This is our flowchart. You see, we found many publications and many other resources in the internet. On the left hand, you see the classical flowchart from the database search. We've done the search with the screening and the search with 3 reviewers independently. We've screened and all the uploaded articles on Ryan independently, and after that we've included 24 articles in our review. articles, publications on digital educational resources in spiritual care. On the right hand, you see the qualitative research, which was done by all of the co-authors in the different languages. We've saved all the URLs, web pages in Word documents. So, and all of these web pages were screened by two reviewers with the with language competency in this language. And yeah, you see there there's some more, so 20 English programs and some more in other languages. So, and what are our findings? So the first research question was about the availability. So are there existing programs? Yes, there are. So we found 52 different digital education programs in spiritual care. And we found them with different target groups, nurses, physicians, social workers, psychologists, healthcare students, chaplains, and multidisciplinary programs. Key result, resources were identified across multiple healthcare disciplines and countries. We've I've put here some written down here some examples, which is just a small group of programs which were very frequently cited or were represented by articles. So you probably know the ISPEC program from Buchalski. You know maybe the spiritual competency training in mental health from Pierce et al. Who presented last time in Salzburg. Then another one was the SCERP and the life questions out of the European context and as a nursing context. And I've listed here the essence of spiritual care is one example of free digital education resources provided by the Australian government freely. What we've seen here in general, most programs were developed in English-speaking countries, particularly in the US, and we can ask ourselves, okay, what does it mean for European contexts or other contexts? What is missing? How usable are these resources? So we've seen lots of different learning formats, fully online courses, blended learning courses, just like the life questions, for example, or some ISPEC courses. Then we've seen massive online courses. It's like the course from Pierce et al. It's available at edX, for example, and we found many different certificate programs for different target groups. We've not analyzed the educational features in detail, so this was the work of Sara Citefana in Portugal and with a Portuguese group, but we found that there were self-paced modules, there were discussion forums, there were scenarios, there were interactive activities, reflective exercises, and so on. All of them are listed in the data sheets, also published with the article, so you have the chance to look at them. You have the possibility to look at them and have a look what are the features of the programs there. What might be challenges in the usability? As I've already told you, there is this challenge of cultural transferability. So everybody knows spirituality is strongly influenced by cultural context, and our healthcare systems differ as well. So we've seen, for example, the ISPEC program, Dr. Megan Best published in the article that they've seen that they had to adapt this program, which is originally from the US, to the Australian context, which is maybe not that much different in terms of language and some culture, but even those, they had to adapt lots of content. So maybe one main concern or key concern is that programs developed in one country may not be directly applicable to another healthcare system or education system, healthcare education system in another country. The third one was how are resources commercialized, how are they commercially distributed. So we've seen there that only few programs were open and freely available, and most required payment or institutional access. So you had to be the student of this university to do this program or something like this. Examples are the STT image from the edX, provided by the edX platform, mostly available for students at the university. The ISPEC is the trainer format, and you see the other certificate programs which are based at the universities. Providers were universities, professional organizations, and also non-profit organizations. And this is one main concern as well, that healthcare professionals maybe in low and middle income countries may face difficulties when students there want to access high quality training or training in spiritual care because of these high costs of these programs, as well as others like language, institutional restrictions, and so on. These are the results. You can have a look at it in the publications. So many different programs according to chaplaincy, multidisciplinary programs, and nursing social work exclusively for nursing or social work. These are the digital resources found, identified in the database research search. Those are the English programs found in the English Google search. You've seen the many different websites and resources, and those are in the different mostly European languages. Maybe you know some of them. Yeah, those are the results. So, main insights. We've seen a rapid growth of digital spiritual care education, especially around the COVID time. Now, maybe it's going back. There are not so many new programs now. It is an increasing number of educational opportunities. There's a global interest, as the WHO says, in digital learning. But of course, yeah, we need cultural adaptation. We have to keep in mind our cultures and our cultural backgrounds, and with no evidence about the long-term effects. Does it have a learning effects? Yeah, it's still open. Of course, we have some study limitations. We've not assessed the quality of the programs, so this would be the next step. We have not assessed the effectiveness. Of course, the Google search is problematic. We don't know the algorithms of Google in detail. So that's it. But it's the same as the students will have when they Google it, the program. So they use the same algorithms, for example. And there might be another additional resources in other languages which are not covered by our research team. So we don't know. Maybe you in South Korea you have some more. So key takeaways: digital spiritual care education is expanding. Many resources are available, but vary in quality. Even if we don't assess this in detail and in accessibility, More research is needed on the effectiveness and on the cultural transferability. How should we validate them, and cultural adaptation, and future programs should support in both those traditionals and digital healthcare settings. That's so far the key takeaways. Thank you so much. Those are the references of this presentation. All the others are published, so you could have a look at the different programs and publications there. You have the link to the publication, and if you'd like to share your experiences, then you can connect with me or with the other quarters and share your knowledge and experiences with digital education in spiritual care. Thank you so much, and I will open the question section.